So we'll start off with what are the problems that we often see. One is we can classify them or divide them into the physical aspects, the problems associated with the physical aspects of the breast, and those with the emotional aspect or the psychological aspects. So when you say the physical aspects, we try to deal with the inverted nipple, the sore nipple or the cracked nipple, then the mastitis, blocked duct, the breast abscess. So these are few of the things which we often see when we are talking about the physical aspects. And when we are saying that the psychological aspects, we try to talk about the mother feeling that there is inadequacy of the milk, baby is not satisfied, and mother feels fatigued or too tired or too stressed, and mother is not very confident about the feeding, and mother would like to go for alternate milk. So wherein we need to do the counseling and then facilitate the breastfeeding. Okay. So the breastfeeding problems which are related as mentioned earlier, and so problems related to psychological aspects are perception of low milk supply, feeling tired and fatigued, and emotionally upset. So we need to give a lot of support to the parents, to the mother. So these are the problems which we often see in the postnatal wards as well as where we come across, which needs to be addressed to facilitate and promote and continuation for the breastfeeding. So what do we how do we handle flat or inverted nipples? Do we so what commonly you suggest or counsel the mothers? Yeah, Dr. Sneha is a pediatrician. How you have come across, you must have come across a lot of mothers or a few mothers in the postnatal wards. How do you counsel them?
First, we explain her to roll out the nipple using her 2 fingers and then immediately try to latch on. If that still doesn't work, we can try syringing. But sometimes that's not needed. Sometimes just a good latch is sufficient. If that is also not working, and then nipple shield in very few cases we can.
Yeah, thank you. So this is how we do the counseling. So there is one is flat nipples. Usually how do you see the normal nipple will be erect and projected outside from the surface of the areola, is it not? So wherein baby will be able to catch, will have a good catching or latching onto the breast. So here what happens whenever there is a flat nipple and sometimes it is an inverted nipple, baby will have some difficulty in latching on, wherein we need to support the mother as well as counsel the mother that the baby over a period of time with lot of patience from the side of the mother that the baby will latch on and there will be continuation of the breastfeeding. So how do we handle them? Is antenatal treatment required for when you identify during the antenatal period? Yes. So how do you think it is helpful? So you want to counsel antenatally regarding? Okay. So what we need to do antenatally is antenatal treatment. What we want all of our colleagues from the obstetrician department to counsel them to promote breastfeeding and to start initiating the breastfeeding before the mother is shifted from the labor room or from the theatre. That is within first hour of the birth. And also we need to counsel the advantages of breastfeeding to the mother. So antenatal treatment of the flat nipple or inverted nipple may or may not be, is probably not helpful, but as soon after the delivery, you build up the mother's confidence and start keep putting the baby onto the breast. And there is for inverted nipples, so when the baby starts suckling at the breast, he will stretch the nipple out and it will further progress to become prominent and baby will be able to latch it properly. And there is something called as Hoffman's technique for inverted nipples, wherein you apply your thumbs at 9 and 3 o'clock position, press into the breast and then pull it outward so that the nipple will come out, and this you repeat on the opposite side at 12 and 6 o'clock position as well. And the other technique, which the syringe technique, which Dr. Nirmala Kesari's method, what we say, that is, it is named after madam, wherein you take this is the normal nipple and that's the inverted nipple. So whenever this is for the you do a syringe, you take a 10 or 20 ml syringe, cut the side where you attach to the needle, and from that side you put the plunger, and then the original plunger from which side it goes in, from that you apply it over the nipple with the support over the areola. Then you try to pull out the plunger slowly so that it will create a vacuum, and over a period of time the nipple will be projected outside. So this is how you do it, and majority of you know this method. So cracked nipple, as Dr. 𝐒𝐨𝐮𝐭𝐡 has already discussed previously. So proper attachment and positioning. Actually it heals, and painful pain at the time of feeding is often indicates that you check the attachment and positioning, and you counsel the mothers and help them. Once or twice, once you show them practically, then it goes a long way in continuation of the breastfeeding. So management, so you already know the 4 points in the attachment and positioning that need to be shown and continued. So sore nipples, so where mother has lot of pain when the baby tries to suckle at the breast. So again you need the counseling, wherein you advise them regarding the proper feeding technique, and some of the mothers usually try to clean up the breast with, every time that they start feeding they would like to clean up the breast, maintaining sterile environment or hygiene, obsessed with the hygiene. They usually keep washing with soap and water, which dries up the nipple and causes sore nipple. So this needs to be avoided. Okay, so how about there is any redness and erythema? You always think about, one is candida infection. So look at the oral thrush in the baby, check the oral thrush as well as whether there is any local candida infection. So you treat it with the oral gentian violet or the nystatin. So breast engorgement, whenever, what are all the conditions where you can get a breast engorgement? Yeah, improper latching. Yes, from the backbenches. Mamta? Yeah. So so whenever there is breast engorgement, you need to look at the risk factors, like whether the differences between full breast and engorged breast has already been mentioned by Dr. 𝐒𝐨𝐿𝐴𝐽. See, what are the backdrop risk factors which lead to engorgement? One is infrequent feeds or inadequate emptying of the breast, or the baby is ill and not suckling for the duration when what is normally baby usually suckle at the breast. So whenever there is inadequate emptying of the breast, there will be breast engorgement. And how do we differentiate it from any abnormality like mastitis or an abscess? So normally you have to differentiate between the full breast as well as an engorged breast. So in engorged breast milk will not be flowing, whereas in a full breast milk will be flowing, and it is a physiological one when there is good amount of milk in the breast. So there will be no fever. So fever may be fever for 24 hours, but it is a painful condition when there is engorgement. Okay, so poor attachment, delay in starting the breastfeeding after birth, and infrequent removal, and whenever there is a decreased frequency of the feeding, there will be engorgement of the breast. So you can see prominence of the veins as well. So how you need to prevent this? Start breastfeeding soon after the delivery and ensure that there are at least minimum 8 feeds in 24 hours and by demand, and minimum the 8 feeds in 24 hours need to be addressed to, and ensure that there is a good attachment and unrestricted. There is not like I will feed once in 3 hours or once in 2 hours. No, whenever the baby is hungry, you put the baby to the breast. So if the baby is able to suck, feed frequently. How do we manage this problem? If baby is not able to suck, you express the milk by manual expression or with the pump, and then feed with a cup and spoon. And before feed, to stimulate the oxytocin reflex, do the warm compresses and then massage. But in the workstations we'll demonstrate. Then light massage of the breast and stimulate the nipple skin, and keep the mother comfortable. Let the mother be relaxed, not to be anxious, because it will have a negative feedback mechanism. And after the feed, to reduce the inflammation, you give the cold compresses. So initially we give the warm compresses, and after the expression or after the feed, give cold compresses. So blocked duct. So whenever there is infrequent feeding, the thickened milk may block the ducts. So if this blocked duct is not addressed to, it may lead to mastitis. Okay, and if not addressed to, it may lead to breast abscess. So these continuation of progression need to be prevented, and whenever there is a blocked duct, you feel a lump over one portion of the breast. So baby need to be positioned in such a way that that area is emptied. Okay, so infrequent or short breastfeeds due to various causes, like mother being very busy, or baby is sleeping at night, or there is a changed routine, or mother is too stressed and not giving the feeds frequently, and then or if there is a poor drainage of part or all of the breast. So because of various causes. Okay, then damaged breast tissue when there is a trauma to the breast, or if there is any nipple fissure where there is entry of the infection. So this is the normal post tissue and the normal duct, and these are the blocked duct. So you see the healthy breast as well as the breast where there is infection, that is mastitis. So how do you treat? You need to improvise the drainage by changing the position of the baby and how the baby is being attached to the breast, so that all the areas are drained, and gentle massage with feeding over the blocked area, which is so that there will be continuation of the drainage and there is relief of the blockage of the duct. And you continue to feed from the other breast as well, and change the position while feeding, right? So this also helps. So current available evidence suggests that cabbage leaf treatment helps reduce the pain in the breast engorgement and mastitis. This is some latest evidence is there. So we had put up, because this is something natural, not much of medications. So newer advances is reverse pressure softening, which we'll show you in the workstations, and therapeutic breast massage in lactational management, and therapeutic ultrasound. So breast abscess, if you do not address the mastitis, then it may go on to breast abscess, which wherein mother will develop fever with chills, and then there will be lot of pain, and there will be swelling, erythema, red tenderness over the breast. This needs to be addressed to by IV antibiotics and incision and drainage of the pus collection. So at the various points there could be a pus collection, the various sites where you can get the breast abscess. So most of the times you need to address it in the earlier stage, and should not allow the mastitis to go on to the breast abscess. Okay, so address whenever there is a blocked duct, whenever mother complains of any pain or there is a lump, please address to that so that it does not progress down to the abscess. So whenever there is an abscess, you need to address. There is IND has to be done, and continue to feed the baby unless it is nearer to the nipple. cleft lip palate, these are, you know that these are the special situations which will be dealt by other speakers. And I'll just tell you the upright position and straddle position or modified football position. These are the various positions by which you can address the mother to feed the baby. Okay, thank you.